number one, we have the test item cluster for mechanical neck pain that will benefit from thoracic manipulation. First, we have symptoms that are less than 30 days. No symptoms distal to the shoulder. Looking up does not aggravate symptoms. FABQ physical activity score of less than 12. Diminished upper thoracic spine kyphosis, so we want them to bring your shoulders back. Just make sure there's no flat back, normal curvature of the spine. And then a cervical extension range of motion of less than 30, so we're going to measure that. Go ahead and look up for me. 42, good. Number two, test item cluster for full thickness rotator cuff tear and subacromial impingement. So the first two that we're going to do, the painful arc and the infraspinatus test, are both for the same. So we'll do the raise your shoulders up for me. Any pain?
Nope.
Good. Bring your hands here for me. Don't let me press in. Good. Okay, and then to differentiate the two, full thickness rotator cuff tear, we're going to be doing the drop arm test. So I'm going to bring your arms out to 90 degrees. Drop it down slowly. Good. And then for subacromial impingement, we're going to do the Hawkins-Kennedy test. Bring your hand out here in front. Good. All right, number three, test item cluster for mechanical neck pain that will benefit from a cervical manipulation. So we're going to have symptoms, the duration is less than 38 days. A positive expectation that the manipulation will actually work. A difference between each side in rotation of 10 degrees. So we're going to measure that now. Go ahead and look to your left for me. Good. Go ahead and look to your right. About 40 both ways. And then pain with posterior anterior spring testing of the middle cervical spine. All right, number four, test item cluster for cervical radiculopathy. We have less than 60 degrees rotation to the involved side. So I'm going to go ahead and measure that. We'll say this is the involved side, so we'll go ahead and look to your right. Good. We have positive Sperling's test. So compression here. Go ahead and extend for me. Go ahead and rotate. Good. Positive upper limb tension test for the median nerve. Press the shoulder, abduction, external rotation, extend the fingers and wrist. Good. Can you look that way? I'll bring it back this way. Good. And then a positive distraction test. Good. Number five, I'll be demonstrating the upper limb tension test 2 for the median nerve. Go ahead and press the shoulder. Abduction, external rotation, extension of the wrist and fingers. Side bend the opposite way. And side bend this way. Good. Number 6, I'm going to be demonstrating the O'Brien's or active compression test. This is normally for labral tear or AC joint dysfunction. And have the patient hands together, thumbs down, apply pressure. Should be pain with that. And then have thumbs up. And there should be pain there as well. All right, test number 7, we're going to be doing the serratus anterior weakness test, or considered sometimes the punch out test. Basically, I'm going to have the patient put their arm out like this. I'm going to apply pressure through there as if you were doing like a punch out. I'm going to look for any serratus anterior scapular winging, any weakness through there. So heavy push. Good. Number 8, I'm going to be demonstrating the moving valgus stress test, and this is for a rupture or tear of the ulnar collateral ligament. Bring the patient up here, extend and externally rotate, apply a valgus force to the humerus, come out. That hurt. Number 9, I'll be having my patient demonstrate the elbow extension test. This is going to be testing for an elbow fracture, and if the patient is not able to fully extend or has point tenderness over the elbow, that's an indication for an elbow fracture. So we'll have the patient bring his hands up. full extension. Number 10, we have the differential diagnosis between the rotator cuff tear, subacromial impingement, versus a C5 or C6 radiculopathy. So we'll start with the rotator cuff tear and subacromial impingement. We already did the infraspinatus test and the painful arc, which would have both been positive for each of those. To differentiate the two between that would be the drop arm test for full thickness rotator cuff tear, and for subacromial impingement, it would be the Hawkins-Kennedy test. With a rotator cuff tear or subacromial impingement, you're going to see pain with overhead motions. Observed weakness, probably because of the pain, in external rotation and internal rotation, and also abduction. Internal rotation, it's the subscap. Abduction and external rotation, if it's the infraspinatus or supraspinatus. So also you might see some atrophy there, depending on how bad the tear is. You're going to see more localized pain. It's not going to radiate distally to the shoulder. It's going to be more localized or point tenderness over the acromion or over the actual muscle and its tendon. So for the C5, C6 radiculopathy, you're going to have a positive upper limb tension test 2 of median nerve. You're going to have a positive distraction test. You're going to have positive Sperling's test. And then you're not going to be able to rotate. You're going to have less than 60 degrees rotation to the affected side. So we already demonstrated that in previous videos. But you're going to have more globalized weakness. So in the C5 myotome, you're going to have a weakness in abduction. For C6, you're going to have weakness in elbow flexion and wrist extension. You're also going to have loss of sensation in the dermatomal pattern. So C6, you're going to have the outside portion of the shoulder and arm and the lateral 2 fingers. And then for C5, the inner portion of the shoulder and then more medial sensation or numbness and tingling. So shoulder motions, though, probably are not going to aggravate symptoms. I think we talked about that in class. I think that you're going to be more point tenderness over the area of where the root would actually leave the vertebral column.